Your Healthcare and HRCH came together just over a year ago through a partnership agreement that's allowed us to make decisions jointly. This has enabled us to join up community healthcare services across the boroughs of Kingston and Richmond. We'd already been working closely together, which had clearly been absolutely crucial during the pandemic, but the core aim of our more formal partnership has been to assure that the local people in our boroughs have access to the same high quality care irrespective of where they live.
HRCH and Your Healthcare have come together in this partnership in order to really focus on the things we can do together to improve the health and well-being of the populations that we serve. I think to build resilience within our workforce and to create new opportunities for employment, which will help us recruit and retain our talent, and also to build resilience within the system too. And I think together we will also ensure that we're making the best use of the scarce resources that we have.
Across Kingston and Richmond, we have worked with NHS, local authority and voluntary sector partners to develop a full range of support services for people suffering with long COVID. We have been involved on very successful COVID virtual ward pilot, oximetry at home and oxygen service. Patients are signposted to access help more quickly, given advice and support so they can cope better with the symptoms of long COVID. We have made services accessible via a web page which lists all of these services in one place for people living in the boroughs of Kingston and Richmond. This is a brilliant example of where coming together has improved services for local people.
YH and HRCH are focusing on investing in improving our underlying IT systems and in developing new technology. Through our collaboration efforts, we are looking at how we can enable our staff members with technology to get safer and faster outcomes, how our systems can talk to each other and share vital information to support the delivery of care. Currently, I'm working with my HRCH counterpart on development of transfer of care hub technology. Well, this provides a seamless exchange of patient information across the providers for supporting the delivery of care. This also includes a single reporting of demand and capacity across the system for optimizing and load balancing across the different providers. The key benefits from this collaboration work effort is that our staff members will have access to digital technology much more faster, and they will quickly learn from our other counterpart if they have done or been in a similar situation where they are trying to introduce a new technology. And it also provides a quicker access to technologies which as a silo organization there has always been a challenge to access it, either through the budgetary or due to the other governance challenges.
Across HRCH, Your Healthcare and Kingston Acute Trust, we've worked collaboratively on the virtual ward project. It's been great for our staff, but more importantly, it's been super safe and fantastic for our patients. We've been really fortunate over the years to have a really strong relationship across HRCH and Your Healthcare for respiratory medicine, but bringing the virtual ward project to fruition has just been so much easier, being able to work together and really focus on our patients.
We've had a fantastic journey over the past 2 years, I would say. Your Healthcare and HRCH have been working really collaboratively on equality, diversity and inclusion initiatives. It's really given us the opportunity to look at where we both are in terms of ED&I, and where there's areas that we can work more collaborative together to ensure that, actually, not to reinvent the wheel again, there is a lot of best practice and good practice that both organisations work with, and it's really good for us to be able to look at our demographic of patients actually and see how we can support them as best as possible, and have a place-based EDI unit to allow us to ensure that we're providing the best care possible for our patients and our communities.
The Transfer of Care Hub for me is a meeting of all the players in the discharge pathway around the patient. It's a patient-focused agglomeration of all the parties involved in that person's discharge. The concept of the project is to enhance the flow of patients through the system. That is the holy grail. Everything about this is in a way integrating and aligning services to achieve just that. So it won't just achieve the discharge pathway, it'll achieve a better understanding of the staff in all the various agencies of each other and the pathways that are available. What we're seeing really is the idea that everybody involved discusses the movement of that patient. The doctors, the nurses, the therapists, the discharge coordinators, the social care teams, and the ward rehab teams all have the chance to focus their entire attention upon that person and plan together for their discharge.
We've made some excellent progress over the last 12 months and are looking forward to continue working closer with each other as part of PLACE and ultimately our development of the ICS. The next steps in this partnership are to use what we've learned as we've worked together over the past 12 months plus as we move towards the PLACE environment. Alongside other partners in the system, we are going to have to take responsibility for ensuring that health and care provision in Kingston and Richmond meets the needs of our communities and that we reduce health inequalities that we do have in the two boroughs.
We have a great opportunity to develop a shared vision and set of priorities that we're going to focus on for this year and beyond. And then in delivering on those priorities, we need to be able to demonstrate measurable benefits for the patients that we care for and also for our workforce, both in terms of their career opportunities, job satisfaction and their own health and well-being.